This morning in the Health Watch, this time last week in the Health Watch, we were awaiting the imminent authorization from both the FDA and the CDC regarding the new generation of COVID vaccines. That has since come to task, or has come to fruition. So now joining us once again to talk about the rollout, talk about what the future of vaccines for COVID and the flu looks like. We're happy to have Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir. Okay, again, no big shakes here. We knew this new bivalent vaccine was coming out. It looks like it's going to be available for people soon. What do people need to know?
Sure. So it's been approved as we predicted, Tim, as of just before Labor Day weekend. Both Moderna and Pfizer vaccine booster shots, updated booster shots have been approved. So if you're 18 and above, you're now eligible for either the Moderna or Pfizer. And if you're 12 and above, you are eligible now for the Pfizer shot. So what people need to keep in mind is if it's been more than 2 months since you've received your last vaccine, COVID-19 vaccine dose, you are now eligible. It's important that you get that shot along with the seasonal flu shot, which should be available any day now as well.
Do you ever see a time where maybe they just get combined into one shot?
Yes, that's the recommendation now. Initially, you may recall when we first started the vaccination campaign for COVID-19, there was a delay that the CDC recommended, but now we have enough data to suggest that we don't need to have any kind of lag between these vaccine shots. And both COVID-19 and influenza should be and can be administered on the same day. I
know sometimes you can get a little bit of a rundown feeling or a really sore arm from the COVID shot, less so from the flu shot. But was there any worry that the natural side effects from the shots could amplify one another?
You know, that's a good question. When you look at what the booster shots have done, there are 80 million shots that have been administered. The side effect profile for COVID-19 vaccines was much lower compared to the initial primary series. So I don't anticipate combining both COVID-19 and influenza would lead to, an increase or amplification of symptoms. And what I always tell folks is, any kind of side effects, which are usually mild and limited in time, are better than the actual disease itself.
Yes. Otherwise, what would be the point, right? Now, of course, we're talking about this because going forward, it looks like, and you may have heard from Dr. Anthony Fauci on our newscast earlier, saying the COVID shot is looking more and more like it's going to be a yearly shot. That's not at all a surprise to people who have been following COVID in the vaccination campaign. Might be a bit of a surprise to people who haven't been following it. What is the rationale behind doing it yearly?
Sure. So based on how this virus has evolved and continues to evolve over the last 2 years, I would not be surprised, per what Dr. Fauci did say, that this will be an annual vaccine. Now, the good news is both for Moderna and Pfizer, we're able to tweak the vaccine to reflect what the most dominant strain is, and that's basically what we did with the new shot, which is a bivalent shot, which is active against the original strain of COVID-19, but also BA4 and BA5.
Now, how about this? Are they sure that it's once a year and not more than that? I just say that because COVID doesn't appear to be quite as seasonal as the flu does, where it's only confined to about 5 or 6 months of the year. COVID seems to happen anytime. Is one shot going to be able to hold you off for a full year?
So we will need to look at how this season pans out and what happens and how this virus evolves. If it continues to evolve to an extent where it's able to dodge vaccine-mediated immunity from the most recently approved booster shot, then we may be looking at something else. But it's hard to say right now. It's too early to tell.
And there's no reason to jump to conclusions. We haven't even gotten into flu season, how to best protect yourself, because it could be coming earlier. We'll talk more about that next week. How about that?
Sounds good.
All right. Dr. Syed Hussain from Trinity Health of New England. He joins us every week to break things down, what you need to know. Thank you so much.
Thank you.
Good to see you again, Doctor.